We are doing our best, but maybe it's not enough.
Urgent warnings coming from Italy's overwhelmed medical community, telling the rest of the world, prepare. This stream of Italian army trucks removing the dead, haunting reality of the inundated morgues.
There is no health system which can take care of all these patients. The hospitals are overloaded and full of patients, especially the ICU.
Dr. Giovanni Landoni works in the ICU department at Milan's San Raffaele Hospital in the Lombardy region, the epicenter of Italy's outbreak, where COVID-19 has been soaring.
In the richest area of Italy, so in the Milano area, we had 800 ICU beds. At the moment, we have 1,000 ventilated patients.
He says each patient requires 2 to 3 members of the hospital staff.
All the routine surgical activities have been stopped. All the staff, nurses, healthcare personnel, medical doctors are now dedicated to intensive care unit. The situation is very serious.
Italian doctors cautioning COVID-19 is much worse than the flu, with many patients developing pneumonia.
What I would suggest is just shut down to stop all the outbreak and not come in this kind of situation that is very, very difficult to manage.
In this Cremona hospital, 120 beds filled to near capacity. Roughly 20% of the medical staff there also infected. Italy now has the highest death toll in the world, more than 600 deaths in just the last 24 hours. The biggest day-to-day increase in the country's 4-week epidemic, over 4,000 have died.
Everyone we meet, everyone lost somebody. Our population is not used to losing so many people at the same time in such an unexpected way.
The U.S. is now in a race against time to make sure it doesn't suffer Italy's fate.
This virus is unforgiving. It spreads before you even know you've caught it.
California, New York, Illinois, and Nevada's governors calling for residents to remain at home, along with mayors of other major cities. That means 1 in 5 Americans now being asked to stay inside. State leaders also asking for any spare supplies.
There are a lot of medical offices that have ventilators that are not operational now, and they're just in the corner of the office. We need those ventilators. The ventilators are to this war what missiles were to World War II.
A new report revealing more than half of the counties in the United States have no intensive care unit beds. 37 million Americans live in those counties. President Trump today activating the Defense Production Act that helps shift production of critical medical supplies. It's a step he previously said he'd only take in a worst-case scenario.
So are we now in a worst-case scenario?
We need, no, it's no different other than we need certain equipment that the states are unable to get by themselves.
For weeks, the federal government has been scrambling to get ahead of the pandemic. But many medical professionals say there's still not nearly enough coordination at the national level.
We are the United States of America. We should not have to be in a position where we have people die simply because we don't have adequate supplies or adequate beds or adequate workforce.
Dr. Megan Ranney is an emergency physician in Rhode Island, a state with at least 54 cases.
We're following the CDC guidelines, which are to reuse procedural masks as long as you possibly can. In other hospitals across the country, I have colleagues who have completely run out of masks or are being told only to use them if they're taking care of a patient who is known COVID positive.
Many of the medical professionals are putting more than just their own lives on the line.
Yeah, my shoes come off here. They never come inside my house.
Dr. Debbie Yee is an ER and ICU doctor in San Francisco. She worries about what she could be carrying back home to her 3 young children after seeing COVID-19 patients all day.
Probably changed my outfit about 4 times already, and I've showered twice. And yeah, it's a little bit of a change in my workflow, but it's all worth it.
Alexis and Gabe Naharo share her fears. They both work in healthcare with 2 sons, and Alexis's 74-year-old mother at home.
This week when I was working, I made sure to come home and basically undress in the garage and shower right away because I'm worried about getting them sick.
Don't leave me hanging.
I am scared though. I think I've gone through a couple different phases of emotions. Since this started, early on I had a lot of anxiety. And now I'm coming to peace with the situation, knowing that it is here.
But they are not bearing the burden alone. Communities across the country are stepping in to help.
Hey, thanks, guys.
Hi, you're welcome.
This group of moms in Marblehead, Massachusetts, some of whom are nurses themselves, are collecting PPEs and medical equipment from other community members who have gear to spare. Tradesmen chipping in like this plumber.
Good to see you too. Thank you so much.
Their efforts being organized by Rebecca Love, a former practicing nurse. Rebecca is the president of SANCIEL, a group that brings nurses, scientists, and innovators together to find solutions to the bedside problems many nurses face.
About a week ago on Facebook, our members started to notice nurses were posting that they were short of supplies. We need to call attention to this issue immediately. There is no time to wait.
Love put together a press release calling on community members and businesses to donate extra supplies to the hospitals and medical communities in desperate need.
So immediately we went to our minds of understanding who had N95 respirator masks. We knew that dentists and veterinarians and carpenters and contractors all have these N95 masks. So we started making phone calls across the country to basically say who could help us.
From Atlanta.
This is the last one.
To Pennsylvania.
We have like 30 N95 masks.
Every little bit helps our frontline providers. Thank you to everybody who is stepping up and donating.
Boston.
Thank you.
You're welcome.
To New York, groups began to mobilize.
All right, go ahead.
Bringing out the best of humanity in the worst of times.
We can't depend on government alone. We as people, as neighbors, as friends, as family, are going to need to do more to help each other now.
Thank you for bringing it.
Dental specialist Jonathan Levine answered the call.
There we go.
Pairing up with the local catering company Eat Sunny, which donated its van, he spent the morning collecting materials from other dentists.
You guys are amazing.
More supplies.
Rebecca called me and alerted me to this problem. So for me, it was a call to arms, and I wanted to get as many of my colleagues on board to really help out here and to make a difference, because we've closed our offices, we have inventory, we're probably not going to open up for a number of weeks.
Levine's road trip ending here, the Hospital for Special Surgery in New York City.
Also delivering next week.
The more the better, you know.
To really help thwart this terrible foe, everybody has to do their part.
In the course of the coming weeks, you're going to hear more calls and ways that you can help. And that is your opportunity to basically step forward and see this nation forward.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.